Welcome to another episode from the Veterinary Medicine Digest. In the complex and often dramatic world of veterinary critical care and oncology, clinicians rely on specialized tools and targeted therapies to manage life-threatening conditions, from massive hemorrhage to aggressive cancer spread. Today, we embark on an in-depth exploration of two highly specific agents used in modern canine medicine: desmopressin, a versatile peptide analog, and cryoprecipitate, a super-concentrated blood product. We will delve into how these remarkable therapies not only halt bleeding in vulnerable patients but, in the case of desmopressin, offer intriguing possibilities in the fight against cancer metastasis. Our journey will also reveal the utility of cryopoor plasma, the often overlooked byproduct of cryoprecipitate production, as an effective tool for managing severe albumin deficiencies. Segment 1. The coagulation conundrum and desmopressin's role. The ability to achieve and maintain hemostasis, the process of stopping blood flow, is foundational to survival, particularly during surgery or trauma. Inherited bleeding disorders, such as von Willebrand disease and hemophilia A, significantly complicate this vital process. Desmopressin, known formally as desmopressin acetate, is a synthetic peptide analog of the naturally occurring antidiuretic hormone, vasopressin. This compound's utility stems from its selective action as an agonist for the V2 cell membrane receptors, which are present both in kidney tubules and, crucially, on the endothelium of blood vessels. When desmopressin activates these endothelial receptors, it triggers a signaling cascade dependent on cyclic adenosine monophosphate, culminating in the rapid, transient release of key hemostatic mediators into the bloodstream. The two most important components released are coagulation factor VIII and the von Willebrand factor. The von Willebrand factor is a large glycoprotein essential for two major roles: promoting the adhesion of platelets to damaged vessel walls, and carrying factor VIII in the plasma to stabilize it. By releasing preformed factor VIII and von Willebrand factor from cellular storage sites, desmopressin provides a rapid, albeit temporary, surge in these critical proteins. Early studies investigating this mechanism in normal, conscious dogs confirmed that intravenous infusion of desmopressin-induced dose-dependent increases in both factor VIII and von Willebrand factor activity in the plasma. The peak increase in factor VIII coagulant activity in these animals, particularly with the highest doses, 2 micrograms per kilogram of body weight, was significant. Researchers noted that the increase in the functional component of von Willebrand factor, measured as coagglutinin cofactor activity, was often substantially greater than the increase in the factor VIII-related antigen, suggesting that the compound was preferentially releasing the higher molecular weight multimers of von Willebrand factor. These larger multimers are believed to be the most effective forms of von Willebrand factor for achieving hemostasis. A key difference between canine and human response was noted in terms of dosing. To achieve comparable effects, dogs required a greater dose of desmopressin than that typically administered to humans. Furthermore, the duration and sustainability of this response were carefully investigated. The factor VIII activity half-life in normal dogs was found to be approximately 5 to 6 hours following a single infusion. However, when repeat infusions of desmopressin were administered over a 24-hour period, the body's response was significantly diminished after 6 hours. This refractoriness supports the hypothesis that desmopressin acts by stimulating the release of preformed proteins from endothelial storage depots, and once these reserves are temporarily depleted, the animal needs adequate rest time to fully restock them before a subsequent dose can be maximally effective. Clinically, this means desmopressin is highly valuable for preventing or managing excessive hemorrhage during surgical procedures in dogs affected by inherited bleeding disorders, such as the high incidence of von Willebrand disease seen in breeds like Doberman Pinschers. In a review of dogs undergoing laparoscopic ovariohysterectomy or ovariectomy who were at high risk due to von Willebrand disease or factor VII deficiency, the perioperative use of desmopressin, often combined with cryoprecipitate or plasma, ensured that no postoperative complications related to hemorrhage were reported. Segment 2. Cryoprecipitate, the concentrated powerhouse of hemostasis. Moving from the pharmacological trigger provided by desmopressin, we turn our attention to cryoprecipitate, a product derived directly from donated whole blood. Cryoprecipitate, or cryo as it is sometimes abbreviated, is defined as the cold-insoluble fraction of fresh frozen plasma that remains after slow thawing and subsequent centrifugation. Its composition makes it a powerful, targeted therapeutic agent. It is rich in cold-insoluble plasma proteins, which include concentrated levels of factor VIII, von Willebrand factor, fibrinogen, also known as factor I, factor XIII, and fibronectin. The primary advantage of cryoprecipitate lies in its sheer concentration. While fresh frozen plasma contains all these factors, cryoprecipitate is resuspended in a minimal volume, typically only 10 to 15 milliliters per unit. This high potency in a small volume is absolutely critical in patients who cannot tolerate large volumes of fluid, such as those that are already normovolemic, are at risk for volume overload, or who suffer from congestive heart failure or renal failure. This specialized component is the reason it remains the preferred blood product for managing bleeding caused by von Willebrand disease and hemophilia A in dogs. Studies comparing it to fresh frozen plasma have definitively shown that cryoprecipitate is more effective in increasing the concentration of von Willebrand factor and shortening the mucosal bleeding time in dogs with von Willebrand disease. Beyond the von Willebrand factor and factor VIII, cryoprecipitate is also a highly effective source of fibrinogen. Fibrinogen is essential for stable clot formation, acting as the precursor to fibrin and supporting platelet aggregation. For dogs suffering from hypofibrinogenemia, a low concentration of fibrinogen, cryoprecipitate offers targeted replenishment. In one laboratory analysis of canine plasma products, cryoprecipitate had median fibrinogen concentrations of 3.46 grams per liter, which was significantly higher than the fibrinogen found in fresh frozen plasma, 1.19 grams per liter, and cryopoor plasma, 0.53 grams per liter. From a blood banking perspective, the quality of cryoprecipitate is directly influenced by the hemostatic protein concentration in the donor plasma. Researchers have established that the factor VIII, von Willebrand factor, and fibrinogen concentration in the donor's fresh frozen plasma all show a positive correlation with the potency of the resulting cryoprecipitate. This suggests that pre-screening blood donors for high levels of these specific factors could enhance the quality of the cryoprecipitate product. This issue of quality led to studies comparing the plasma products from greyhounds, a breed frequently used as blood donors, against non-greyhound dogs. Although greyhounds generally have a higher hematocrit and yield a smaller volume of plasma per donation, they also tend to have slightly lower baseline plasma concentrations of von Willebrand factor and fibrinogen. Consequently, cryoprecipitate prepared from greyhound plasma was found to have lower von Willebrand factor and fibrinogen content compared to that from non-greyhounds. Importantly, however, even these units prepared from greyhound donors were generally found to be acceptable when measured against the minimum quality standards used in human blood banking for these factors. Therefore, the use of greyhound plasma for cryoprecipitate production is generally justified. Finally, the safety profile of cryoprecipitate in dogs appears highly favorable. Unlike fresh frozen plasma, which carries a 67% rate of adverse events in one comparative study of dogs with congenital coagulopathies, cryoprecipitate showed a 0% incidence of adverse reactions in that same cohort. While rare, minor reactions such as a transient fever, restlessness, or mild hypotension have been reported in some dogs receiving cryoprecipitate. These reactions are typically non-severe and resolve quickly, often without intervention. Segment 3. Cryopoor plasma, the unexpected utility. When cryoprecipitate is produced, the remaining supernatant liquid is collected and is referred to as cryopoor plasma, cryosupernatant, or cryodepleted plasma. Historically, this fraction was considered a less useful byproduct, as the factors that precipitate out, factor VIII, von Willebrand factor, and fibrinogen, are precisely the elements most needed for immediate hemostasis. However, modern research has identified two primary and valuable uses for cryopoor plasma, making it a critical component of targeted therapy, particularly in dogs. Subsegment A. The albumin advantage. The separation process concentrates albumin in the cryopoor plasma. Laboratory studies comparing cryopoor plasma, cryoprecipitate, and fresh frozen plasma found that cryopoor plasma contained a significantly higher mean albumin concentration and colloid osmotic pressure compared to the other two products. One study measured the mean albumin concentration in cryopoor plasma at 31.7 grams per liter, notably higher than the 28.9 grams per liter found in fresh frozen plasma. This elevation in albumin concentration and colloid osmotic pressure is clinically significant because hypoalbuminemia, low circulating albumin, is a common and often devastating finding in critically ill dogs suffering from conditions like septic peritonitis, hemorrhage, or severe protein loss. Hypoalbuminemia is strongly linked to decreased survival, poor tissue healing, and increased risk of edema. Because species-specific albumin concentrate is often unavailable or expensive, fresh frozen plasma is sometimes used for replacement, but this requires administering massive volumes, leading to a significant risk of volume overload. Cryopoor plasma circumvents this problem. Because it is a more concentrated source of albumin, and because it is often significantly cheaper, in some blood banks, approximately half the cost of fresh frozen plasma by volume, it offers a more financially feasible and less volume-intensive alternative for albumin replacement. Retrospective clinical studies support this use. In a group of critically ill, hypoalbuminemic dogs receiving cryopoor plasma as a continuous rate infusion, there was a statistically significant association between the rate of cryopoor plasma administration and the resultant increase in albumin concentration. This evidence strongly suggests that cryopoor plasma is a viable and potentially superior option for treating hypoalbuminemia compared to standard fresh frozen plasma in certain critical canine patients. Subsegment B. Vitamin K deficiency and toxicology. A second critical utility for cryopoor plasma lies in managing toxicological emergencies, specifically those involving anticoagulant rodenticides. These toxins interfere with the recycling of vitamin K, leading to a functional deficiency of the vitamin K-dependent coagulation factors, factors 2, 7, X, and X. Laboratory analysis revealed that cryopoor plasma contains statistically similar activity levels of vitamin K-dependent factors 2, V, and X when compared to fresh frozen plasma. In vitro studies simulating anticoagulant rodenticide intoxication confirmed this finding. When researchers mixed cryopoor plasma into factor-depleted canine plasma, it corrected the prolonged coagulation times, both the prothrombin time and the activated partial thromboplastin time, and replenished the critical factors, factor 2, factor 7, and factor X, to the same degree as fresh frozen plasma. Although fresh frozen plasma contained a significantly higher concentration of fibrinogen than cryopoor plasma, the cryopoor plasma's ability to correct the coagulation pathway factors was comparable. These findings support the use of cryopoor plasma as an effective and potentially cost-saving alternative to fresh frozen plasma for emergency treatment of severe bleeding caused by anticoagulant rodenticide intoxication. Clinicians suggest that cryopoor plasma can be administered at a dose of 10 to 20 milliliters per kilogram of body weight, similar to conventional fresh frozen plasma dosing, to effectively restore depleted coagulation factors. Thus, the targeted use of cryopoor plasma, for albumin and vitamin K-dependent factor support, demonstrates excellent stewardship of blood resources, reserving cryoprecipitate for its specific role in managing von Willebrand factor and fibrinogen deficiencies. Segment 4. Desmopressin's unexpected oncological frontier. While desmopressin is primarily known for its powerful hemostatic properties, research in veterinary oncology has uncovered an entirely unexpected and profound role for this peptide analog, fighting the spread of cancer. The antimetastatic potential of desmopressin was initially observed in mouse models of breast cancer, where the drug inhibited lung and lymph node metastasis. Subsequent pilot veterinary clinical trials involving bitches with locally advanced mammary carcinoma offered compelling confirmation. These trials focused on administering desmopressin perioperatively, in one study, at a dose of 1 microgram per kilogram intravenously, 30 minutes before and 24 hours after surgical removal of the primary tumor. The results were statistically significant. Desmopressin therapy significantly prolonged both disease-free survival and overall survival in the dogs compared to the placebo group. Crucially, the benefit was highly dependent on the aggressiveness of the tumor. Desmopressin significantly prolonged survival in dogs diagnosed with moderately or poorly differentiated mammary carcinomas, histological grade 2 or 3, respectively. However, no statistically significant difference was found in survival rates for dogs with well-differentiated, grade 1, tumors. This observation strongly suggests that desmopressin may be an excellent candidate as a surgical adjuvant therapy, specifically in the management of aggressive cancers in small animals that carry a high risk of recurrence or metastasis. The underlying mechanism is complex and thought to be dual action. First, the same mechanism that induces hemostasis plays an antimetastatic role. The rapid release of large, highly multimeric forms of von Willebrand factor induced by desmopressin appears to play a protective role against tumor cell dissemination. It is theorized that this massive release of von Willebrand factor favors the collapse and death of early metastatic foci, possibly by obstructing the sustained adherence of malignant cells in the microvasculature of the target organ. Second, desmopressin may exert direct antiproliferative and anti-angiogenic effects. The V2 vasopressin receptors targeted by desmopressin have been detected in many human cancer cell lines and also in 1/3 of the breast tumor samples evaluated in one human trial, suggesting a direct line of action. In vitro studies on canine mammary carcinoma cell lines confirmed that desmopressin inhibited the proliferation of these tumor cells at high concentrations, 1,000 nanomoles per liter, supporting the hypothesis that the drug can combat residual malignant cells after surgery, thus limiting tumor progression. Furthermore, desmopressin has been shown to reduce tumor angiogenesis, the formation of new blood vessels that feed tumors, by inducing the creation of angiostatin, a naturally occurring inhibitor of vessel growth. This evidence suggests that desmopressin, administered during the critical perioperative window, minimizes metastatic events by stimulating host resistance mechanisms, combating micrometastases that may have been shed before surgery, and reducing intraoperative bleeding. These promising veterinary findings paved the way for human clinical trials, where desmopressin was found to reduce intraoperative bleeding and lead to a drop in circulating tumor cell counts post-surgery in human breast cancer patients. Segment 5. Synthesis and future directions. We have explored 3 specialized blood-related components, each playing a targeted and highly effective role in canine critical care and oncology: desmopressin, cryoprecipitate, and cryopoor plasma. The foundation of successful transfusion medicine today rests on moving away from general blood products toward goal-directed selection based on the individual patient's precise needs. Cryoprecipitate remains the gold standard for treating specific factor deficiencies in dogs, primarily the low von Willebrand factor and factor VIII associated with inherited bleeding disorders. Its power lies in concentration, allowing high doses of critical clotting factors and fibrinogen to be delivered in a volume small enough to prevent potentially fatal volume overload. Cryopoor plasma, the former byproduct, has emerged as an invaluable and cost-effective alternative for treating hypoalbuminemia, leveraging its naturally high concentration of albumin and colloid osmotic pressure. Furthermore, its equivalent content of vitamin K-dependent factors, factor II, V, and X, makes it a viable frontline therapy for anticoagulant rodenticide toxicity. Desmopressin offers a fascinating dual function. Clinically proven to stabilize hemostasis in dogs with von Willebrand disease, it also demonstrates a powerful, targeted effect against aggressive mammary carcinoma in canine patients, primarily by triggering the body's own antimetastatic response via the release of von Willebrand factor. While the evidence supporting the targeted use of cryoprecipitate and cryopoor plasma is robust in the laboratory and growing in clinical practice, many opportunities for further investigation remain. Determining optimal dosages for cryoprecipitate in various acquired coagulopathies and performing large-scale, prospective-controlled trials comparing the efficacy of cryopoor plasma against fresh frozen plasma for albumin replacement are vital next steps. Similarly, the exact mechanism and full therapeutic potential of desmopressin in canine oncology require continued exploration. The specialized application of these concentrated components ensures that veterinarians can offer highly personalized, efficient, and life-saving care, maximizing the therapeutic benefit of every blood donation while minimizing risks to the most vulnerable patients. Thank you for listening. The titles for the referenced papers are in the video description. From VetMed Digest, where we keep minds inspired, hearts light, and tails wagging.